I'm from the Department of Traditional Chinese Medicine of First Affiliated Hospital of China Medical University. Today, I will introduce ear acupuncture to you. It includes the conception, the anatomy of auricle, the distribution of auricular points, clinical application of ear acupuncture. First, let us see what is ear acupuncture. Ear acupuncture treats and prevents disease by stimulating certain points on the auricle with needles or other tools. This therapy has extensive indication and easy to manipulate. Diagnosis can also be made by observing, pressing, and measuring the electrical resistance on the auricular points. The basic skills commonly used auricular point therapy include massage, needle, sticking and pressing with 王不留行 seed, and bleeding. Part 2. The anatomy of the auricle. Now, let's look at the anatomy of the ear. For the convenience of the locating ear points, the anatomical structure of the auricular surface relating to ear acupuncture are described as follows. Look at this picture. This is the whole anatomy of the ear. And next is the main anatomy of the ear. Let me give you a brief introduction. The top of the auricle was called ear apex. The point is on it. We can treat hypertension by blood lighting at ear apex. Part 3. The distribution of auricular points. The beginning of modern ear acupuncture began in 1957. In the 1950s, a French surgeon, Dr. Nogia, started the systematic study of auricular point diagnosis and treatment. In 1950, Nogia learned from a folk doctor that a woman suffering from sciatica accidentally burned her auricle, and her sciatica was cured. Dr. Nogia spent 6 years studying auricular points and drew the corresponding points of each part of human body on the auricle one by one and draw a map. The distribution of auricular points. Look at this picture. Auricular points are distributed on the specific regions of auricle. The distribution of auricle points on the auricle has a certain rule, just like a fetus, with the head downwards and the buttocks upwards. Key points. Located on the lobule and around it are related to the head and the facial region. Those on the scapula to the upper limbs. Those on the anti-helix to the trunk and the lower limbs. This auricle can be divided into several regions according to its anatomy, and there are totally 91 auricle points. Look at this picture. This is a diagram of the back of the ear, which is divided into 5 parts: heart, spleen, kidney, lung, and liver. Clinical application of ear acupuncture. Indications of auricular points. Pain syndromes. It includes headache, various pains, and etc. Infectious and epidemic disease. It includes acute or chronic stomatitis, dysfunction disease. It includes gastrointestinal neurosis, and etc. Allergic disease, endocrine disorders, and others. Principles of selecting points. The first, selection of points according to experience. Second, selection of points according to physiological and pathology Western medicine. The third, selection of points based on differentiation of syndrome. The fourth, selecting points according to auricular points according to the diseased area. Precautions. It includes 3 points. The first, strong stimulation should be avoided for severe heart disease and hypertension. The second, acupuncture should be contraindicated for pregnant women. The third, prevent needle faint. We all know that if the quality of sleep is not good, it will affect our body physical health. So what is a better way to treat insomnia in traditional Chinese medicine? The following is to introduce the common methods of auricular therapy for insomnia for you to understand. The first picture is one producing seed, and the third picture has 3 main points from up to down. The first is Shenmen, the second is heart, and the last is brain points. Thank you. That's all for today.